Hi, it's Dr. Epstein. I'm going to talk this morning about the design of an eyebrow for a transplant. We have a patient today who overplucked her eyebrows. As a result, she's got a lot of asymmetry as well as just impartial or incomplete length of the brows. When designing eyebrows, of which I do typically 3 or 4 of these every week, there's a lot of things I take into consideration, not only where the original eyebrows were, but also the shape of the face, in particular the shape of the orbital area. There's a whole variety of shapes that, in terms of how heavy the brow fat pad is, the shape of the eyes. So these are all things which I take into consideration, and it's it's a very important area, obviously, because it's framing the eyes. In this case, let's take a look at our patient today, and you can see that she had, in her case, asymmetry of her existing eyebrows. They were rather thin. She has a very long, thin, well-defined face, very well sculpted. So we didn't want to create eyebrows that were too sharp. In other words, I didn't want to create a very high arch. I do find that arches work better for particular ethnic groups. In particular, Asians tend to look better with more sharp eyebrows. Not necessarily. Most of these things I'm talking about are relevant to women. Men is a different issue, and that's the subject of another video. But for a woman, most women do like to have well-defined eyebrows. In this patient's case, I went ahead and this portion here is called the head of the eyebrow. I brought it in. I like to make it somewhat flat, and then I like to create a nice gentle arch through the body of the eyebrow. This point here corresponds to the outer aspect, somewhere between the outer aspect of the pupil of the iris, which is called the lateral limbus, and the lateral canthus, which is the outermost portion of the eye, where the eyelids come together. And then I create a nice gentle slope out here. You'll see that I do have a little bit of an arch down there. Her own natural hairs are a little bit lower. She can always pluck those, or or just leave them there and just have a little bit of fullness. And you can see here, just really just a nice look. What's going to happen next is we're going to pluck we're going to take the donor hair from the back with a single incision, and then the hairs will get placed one at a time. Typically I anticipate in this case doing a procedure of around 500 to 550 hairs. Just about all single hairs in this case. Sometimes I will use 2 hairs if patients have very fine donor hair. Her hair is actually amongst the most ideal. It's got a little bit of a curl to it, a little bit of a wave, so it's not a perfectly straight hair, which can be a little more difficult with which to deal. And it'll also blend in nicely because it's not overly hard or coarse. It's somewhat of a soft hair. Best thing is she was very happy when I showed out the marking. She's shaking her head and smiling. Anyway, this is Dr. Epstein, and laughing. This is Dr. Epstein. Thank you very much.